Hello and welcome to the UT Health San Antonio Community Support Webinar. Today's topic is Change and Resiliency for Clinical Support. My name is Michelle Mata and I will be your host for today's webinar. Today's presenters are Dr. Liza Maldonado and Dr. Adriana Dyurich. Dr. Maldonado is a behavioral health consultant for graduate medical education at UT Health San Antonio. Dr. Dyurich is the academic success consultant for graduate medical education at UT Health San Antonio. At the end of this webinar, individuals will be able to recognize the grief process as it relates to grieving the losses due to COVID-19, discuss coping strategies and build resilience, and identify relevant wellness resources. Now, let's begin with Dr. Maldonado.
Thank you for inviting us to speak with you today. Many journalists these days are writing about people's reactions to the COVID-19 pandemic. In the news, we keep hearing the word anxiety. But as a psychologist, the word I keep hearing in my sessions with patients is loss. Many people are experiencing a great deal of loss in this global pandemic. And when we think about loss, there are obvious losses, such as the loss of life, loss of a loved one, loss of health, and for many people, loss of jobs and income. But there are also countless less obvious losses that are affecting our emotional health. Missed commencement ceremonies, canceled sporting events, delayed weddings, and for so many students and physician trainees in our community, separations when we need them the most. There is also the loss of the predictability that we take for granted in daily life. For example, that there will be toilet paper in the grocery store, that you will be able to get a haircut today, that your child will be able to attend school. And of course, there is also the general and profound loss of normalcy as our daily routines keep changing from one day to the next. I'd like to spend a few minutes talking about how we are grieving these losses and how to move toward a state of acceptance. Acceptance is important because it leads to empowerment. My colleague, Dr. Dyurich, will then discuss specific ways of coping and building resilience. My brief part today will be based on a beautiful piece of writing by David Kessler, the world's foremost expert on grief, who has co-authored works with Elizabeth Kubler-Ross. I highly recommend reading the article, That Discomfort You're Feeling is Grief, by David Kessler. Next slide. Before we get to talking about grief, I just want to mention the importance of processing grief. We know that unresolved grief can lead to chronic stress, and chronic stress exacerbates many serious health problems. As members of a healthcare community, we already experience high stress on a daily basis. And during a pandemic, we are more likely than the average person to experience chronic stress or anxiety. So what we're trying to do by sharing this information is promote awareness and those behaviors that can protect us from the worst effects of chronic stress. In his article, Kessler touches upon the anticipatory grief that is breaking down our sense of safety. With this virus, we know a storm is coming. Our primitive mind knows something bad is about to happen, but we can't see it directly. So we are likely to feel generally unsafe. With so many people experiencing anticipatory grief at once, we are grieving both on a micro and a macro level. To me, it feels completely unprecedented. Never in my lifetime have I witnessed this level of global fear. Kessler warns us to watch out for signs of unhealthy anticipatory grief, which is really anxiety. The good news is that we can manage anticipatory grief just like any other type of grief, moving forward toward a more deliberate, rational approach. Kessler suggests that we need to move forward through the stages of grief. Let's look at those stages as explained by the Kubler-Ross model. As I go over these stages, please remember that they are not linear. They can happen in different order for different people, and we can easily move back and forth between the stages. During pandemics, things keep changing, and there's no definitive end, so we are more likely to vacillate between the stages, and this is normal. People in the shock and denial phase are confused and afraid. They might also feel numb and start avoiding. They may say to themselves, "This virus really isn't that bad. It probably won't affect us." And so they are less likely in this stage to heed government warnings. As we move in, we start feeling more anxious, frustrated. We may also experience embarrassment or shame and say to ourselves things like, "You're making me stay home, you're taking away my activities, this is awful, and it's unfair." For some people, the anger stage leads into a stage of depression and detachment. But for others, it might lead into the dialogue or bargaining stage. People who fall into sadness may experience a lack of energy. They might feel helpless and overwhelmed and start catastrophizing, thinking things like, "This pandemic will never end. My loved ones will die. I'll lose everything." Someone in the dialogue and bargaining stage, reaching out to others, they might want to tell their story again and again, while struggling to find meaning for what has happened. In this stage, we tend to think in very concrete terms. For example, saying to ourselves, "Okay, if I social distance for 2 weeks, everything will be better." Finally, as we move toward acceptance, we begin to problem solve. Executive functioning improves, and we start exploring options. This is when we start making plans. This is when our confidence starts to grow. We might be thinking, "Okay, this is happening. I have to figure out how to proceed." Acceptance is critical because with acceptance there is power. This is when we start to realize that we actually do have some control. I can wash my hands. I can keep a safe distance. I can learn how to work virtually. Even if my job requires me to be in clinical settings, I can monitor myself and others to reduce the risk. It is critical that we in this healthcare community continue to work on acceptance. And that we recognize that acceptance does not mean blindly following orders. Quite the opposite, in fact. What it means is diving into problem-solving mode, working with your colleagues to brainstorm ideas and set goals, monitoring your progress toward the goals, and noticing that progress builds confidence. Anticipatory grief can look like the mind going to the future and imagining the worst-case scenario. So to calm yourself, come into the present moment. Dr. Dyurich will discuss strategies for being more present, but right now I will just ask that you work on allowing yourselves to feel whatever it is you're feeling. Acknowledge the feeling without judgment. So many of us in healthcare try to suppress feelings in order to take care of the sick. We might think to ourselves, if I let myself feel sad, I won't be able to control it. It will keep growing, and I won't be able to do my job. This is not true. Feelings pass if we simply acknowledge them without fighting against them. Once you notice that your body has the ability to tolerate a feeling, let it pass, and move on, you will be truly empowered. It's also important to find balance in the things that you're thinking. Kessler suggests that if your mind starts focusing on the worst possible outcome, everyone will die, this is the end of civilization as we know it. Make yourself think of other possibilities. Not everyone I love will die. Maybe few people will, because we're all taking the right steps. In this process, neither scenario is ignored, but neither becomes dominant either. Kessler reminds us to overprotect, but not overreact. And at the same time, we want to be wise in our efforts to overprotect. We need to let go of what we cannot control. What your neighbor is doing is out of your control. What is in your control is staying 6 feet away from them and washing your hands. Focus on that. As the stress continues to rise, it'll also be helpful if we focus on building compassion. Everyone will have different levels of fear and grief manifest in different ways. If a colleague seems difficult right now, try to extend some grace. Finally, we need to notice when that stress is rising and try to implement coping strategies. Dr. Dyurich will now discuss some specific strategies for coping with stress and burnout while also building resilience.
Let's briefly discuss stress and burnout so you can choose the strategies that will help you cope and build resilience in unique and personal ways. Stress and burnout are not the same, although they are closely related. The World Health Organization defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by 3 dimensions: the feeling of energy depletion or feeling exhausted, increased mental distance from one's job or feeling of negativism or cynicism related to one's job, and reduced professional efficacy. The signs and symptoms of both stress and burnout could be emotional, physical, or behavioral. Each of us experiences stress and burnout in a unique way, and it's important to identify how they show up for us so we can implement coping mechanisms that work for our needs. In general, the signs of stress are overengagement, feeling emotionally reactive or even overreactive, a demeanor of anxiety or hyperactivity, a sense of urgency, and feeling that stress is physically tolling. I like to explain the difference between stress and burnout this way. It is just like a light switch. When in stress, you feel you are worried, you are active, you are moving around, you are thinking too much. When burnout, the switch turns to off. Then we feel disengaged, our emotions are blunted, the demeanor is one of depression and detachment, and we feel a sense of helplessness and hopelessness. Burnout is emotionally tolling. Actually, the heart of burnout is emotional exhaustion. The best way to cope with stress and burnout is to build psychological resilience. Resilience is defined as the capacity to recover quickly from difficulties or toughness. It is the ability of a substance or object to spring back into shape. Psychological resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant source of stress. Well, this is the perfect time to practice resilience. The good news is, As much as resilience involves bouncing back from these difficult experiences, it can also involve profound personal growth. So let's discuss specific steps that you can take to build resilience. As I go through them, I invite you to think how each of them can apply specifically to you and your role as a clinician. I also invite you to think in an open and dialectical manner. The glass is not half empty, neither is half full. The truth is, the glass is both at the same time. In moments like this, it's important to see both sides and accept both realities. You might find comfort and strength precisely in the places where you feel most vulnerable. For example, recharge. Sleep, good nutrition, and regular exercise are a great start to feel recharged. I also invite you to think, what relationships, activities, maybe hobbies, what makes you smile? Get creative. If you're used to going to the gym and you can't, you might find similar benefits by walking your dog, playing with your kids, or even dancing. I can tell you my kids and I have been throwing some good dance parties at home. Regulate. It's important to mind your emotions, identify them, and name them. Emotions are a guiding mechanism to help us navigate the world around us. Now, they're not facts. They're not thoughts either. Emotions are emotions, and there's no need to act out on them if we are able to listen to their message. Be mindful of the emotions. Be mindful of what you're feeling without needing to get hooked into the negative thoughts that might come with them. Once you recognize your emotions, you might be able to let them go. Create connection. We're promoting physical social distancing and isolation, but that doesn't mean we need to feel emotionally disconnected. It's a good idea to use technology to reconnect with friends that you haven't seen in a while or to stay close to our loved ones. This is a great time to increase support, to feel supported and support others that respect boundaries. Set and preserve personal boundaries, and remember that your boundaries are based on your personal values. By respecting boundaries, we increase our sense of control. Just like Dr. Maldonado was saying, we cannot control everything that is happening around us, but we can take control of those things that are our decision. As a member of a team, you can help each other build resilience also. Emotions are contagious. That's why it's so easy to feel anxious when everyone around us is feeling that way. But empathy, friendship, and loving care are contagious too. Some of the steps that we can take to help the team build resilience include acknowledgement. Say or do something that acknowledges another's presence. A simple hello or a nod. I personally love the 10-5 rule. If someone's 10 feet away from you, offer at least visual contact. If somebody's closer, and we now need to maintain some distance, but offer at least a verbal greeting. Offer also appreciation. Say thanks for a contribution, admiration for a quality of the specific contribution. Be specific about this. Looking out for the good in others will also help you utilize one of the most effective resilience strategies, gratitude. Dr. Maldonado also talked about the importance of accepting ourselves, our feelings, and our circumstances. Let's show others acceptance as well. Welcome a person into a conversation, a group, or a project. Accept how you and others are feeling. And last but not least, accommodation. This is a great way to increase support. Be flexible and build community by working as a real team. You might need to modify activities or space to help each other work more effectively and more comfortably. And remember, we are immensely grateful for what you do and all you give and sacrifice to take care of others. Keep in mind that there are people out there to support you as well. Let's talk about some resources that are available to you.
As we continue to support each other through this global crisis, let's remember, we have to go into the despair and go beyond it by working and doing for somebody else, by using it for something else. At UT Health San Antonio, this is something that we are really good at. Doing for others, working towards the greater good. Now let's take a look at some resources that can help us along the way. UT Health San Antonio and UHS has employee assistance programs to provide counseling services for faculty, non-faculty UHS employees, and residents and fellows. Please visit their websites to learn more about available services. In the GME Wellness Program, Dr. Dyurich and I provide assessment, counseling, and other wellness-enhancing services to UT Health San Antonio physician residents and fellows. Please visit our site for more information. Please also bookmark the following websites so that you can stay informed and receive up-to-date information as it develops. The Environmental Health and Safety website and the UT Health COVID-19 website. Please also take a look at the services available through our Employee Health and Wellness Clinic. As we continue to practice social distancing, we may become less active and less mentally and physically engaged in our lives. Here, we have included several free online meditation resources. For those of you with NPI numbers, Headspace has offered free premium memberships to the healthcare community. And anyone can access free online meditation training exercises at sharingmindfulness.com and UCLA Health. On this slide, we have put together a list of various websites that are offering free fitness classes, given that many gyms across the country have closed their doors. Finally, we leave you with our contact information. Dr. Dyurich and I are happy to provide any additional information. We want to be a source of support as we all continue to move forward through this difficult time. Thank you so much for tuning in to this webinar.
Thank you, Dr. Maldonado and Dr. Dyurich, for presenting today's webinar on Change and Resiliency for Clinical Support. Also, thank you to each of you who viewed this webinar. We hope you found this information helpful. This concludes today's webinar. Thank you and stay safe.